Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Navaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. We are very excited about today's guest. We've got the author of The Pulse Cure, Dr. Torkil Færø. This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients. It's a wonderful honor to have you here, and JP and I are excited about today's discussion.
Yeah, it's an honor to be on your podcast as well. I've heard so many fantastic episodes with both of you, and read both your books. I must say that they're really, really wonderful books.
Wonderful. It's amazing that this is such a topic that we have 3 different avenues kind of talking about the same concept, the autonomic nervous system, the effect that it has on all of the different systems within our body, and ultimately, a lot of the outcomes and a lot of the recommendations are very similar amongst all 3 of our books, but 3 different approaches and 3 different ways of looking at it. And I think I want to discuss with you your approach and kind of what got you interested in looking at the pulse, looking at heart rate variability, and helping to create positive lifestyle changes in the lives of your patients. So let's get started with understanding your story. What got you into medicine in the first place?
Yeah, actually, what got me into medicine was a sense of adventure. That was just to be able to live a free life, to be working as a doctor, as a general practitioner in emergency medicine, and to be able to travel to work parts of the year, then go traveling. And that was actually my entrance into medicine. So it was not the very interest in medicine just in itself. So that is maybe part of the reasons why I have been having a different journey into medicine, because what I was also doing was a lot of photography. And that has a connection to the nervous system, the autonomic nervous system, because I understood that when I was photographing and teaching people photography in workshops, we were using the autonomic nervous system. And it was a kind of use that I was not familiar with from medical school, but because we learned that it was a fight, flight, and freeze, or rest and digest, and not hunt and fun. So I understood that, okay, hunting and having fun is also a use of the autonomic nervous system, and I had not read anything about it. And then I started to be curious about it. I started understanding that we could use the heart rate variability as a measure of it. And that just fired my passion for it. So I started using ECG monitors for 2 years, with no explanation. I just saw the curves, whether I was in the sympathetic mode or in the parasympathetic mode. And after a couple of years, I understood that Garmin had the same system in their watches. And that, so many people have it. So then I understood that, okay, we can use an instrument that people already have, and that has so much more use, and that they can understand and regulate their autonomic nervous system easily. And via a lot of serendipitous meetings and people, I came to write the book, The Pulse Cure, which has been a tremendous bestseller in Norway. Just today, I got the message they are printing the 11th edition of it, and it's been on the bestseller list for almost 2 years. So it has kind of changed the way that so many health-interested Norwegians are using this. They will become familiar with the term of heart rate variability, that they can take charge of their own health instead of waiting until they get a disease and then the doctor is in charge. So it's a huge shift in mentality in health.
Yeah, it's a really empowering process. And so congratulations on the book becoming such a wonderful bestseller.
Yeah, I was just going to say that same change is happening here in the United States. People we're just now seeing this shift away from, you go to the doctor when you're sick, as opposed to, hey, let's find ways to keep ourselves healthy and not ever get there. So to the extent that you've been part of that, of triggering that, I'm sure your book has been part of that wave. It's a wonderful thing to see. People are becoming more educated on heart rate variability, on the immune system, on the vagus nerve, on all sorts of different things, about their diet, exercise. It's very important.
Yeah, and the good thing about the vagus nerve is that we can actually control it. We can actually, if not only directly control it, we can also let it work, and sleep and rest and be in the sun, and grounding and all these different things that we can use to activate the autonomic nervous system. And I know that you also have the experience with different vagus nerve stimulation that I would very much like to try.
Yeah, I think it would be really beneficial in your practice. But why don't we get into a little bit about your concepts that you initially brought out? And you mentioned that a lot of people don't truly understand the concept of inflammation. And I think this is an important one because we often, and even just last night, I was watching television and there was an ad for a pharmaceutical medication that obviously threw me a little off. And they said, well, the root is inflammation, the root cause of this particular, and there was a dry eyes based condition. And they said the root of it is inflammation. That's not true, right? We know that inflammation is a process, but I'd love to kind of understand your take on this and get your explanation as to what inflammation truly is.
Yeah, so as I understand, is that chronic inflammation, having too many cytokines in our system as a signal that our body is under pressure from so many different sources and also unexpected sources, is the root cause of so many of the diseases that we are treating as doctors these days: heart disease, cancer, autoimmune disease, a brain fog, all this, fatigue. Almost all the diseases that we treat as doctors, I've heard the numbers around like 80% is one I hear a lot in health-related podcasts. So that this chronic inflammation is kind of the base or the root cause of all these different kind of diseases. And as doctors, we are used to that every specialty is kind of working at their final end of the chronic inflammation, and I don't understand that the common denominator that connects all this is the inflammation in the system that we can luckily track with heart rate variability. Jenna Makioki, she's an immunologist, and she says that the heart rate variability is a quite precise measure of the condition of your immune system and this chronic inflammation. That is my understanding of it. Just tell me if I'm wrong here. So,
no, that's exactly right. It's I think of it. I think of a couple of things when you were talking that sort of blossomed in my head. One is I always like to make parallels in physics, being an engineer. But think of it like one of Newton's laws that says every object in motion will stay in motion unless acted on by an external force. I think of stress and injury and anything that can disrupt your homeostasis, anything that pushes the system out of its happy place, if you will generate inflammation. It will generate an immune response because the response of the body has to be to push itself back towards that homeostasis. It's almost like inertia. You're trying to push yourself back into that place of comfort. And so anything that pushes you out of that will activate the sympathetic nervous system and will drive sort of you to push back against it. And that push can be too much. So you can end up with that push sort of not restoring homeostasis, but going beyond it. When you ultimately need to restore back, that's when you need the parasympathetic. That's when you need to calm the immune system down and bring it. It's sort of like the universal dampening system. It's dampened.
Push away, and you can push away, to my understanding, you can push away the parasympathetic system so much. As long as you're in the doing mode, then the parasympathetic system will not be able to work properly or 100%. And of course, so many people, me included, thought that as long as you're doing something fun, you're not taxing your autonomic nervous system at all. It was not in those fight, flight, or freeze. So I think that a lot of people will not be aware of what is stressing them. And once I started tracking my autonomic nervous system, I saw that food would have so much impact on my system. For example, altitude, alcohol, and so many things that was a total surprise to me. So of course, when you don't know what stresses you, and you have no idea of how much, because I find that our senses directed towards the outward threats throughout history, they're so acute. We can see 10 million different colors. We can smell like a trillion different smells. I understand. But whether I have 60 or 85 in heart rate right now, for example, I have no clue. So it just tells you how little sense we have for our inner state. And if we could feel the noise of our inner state, it would interfere with all those all important signals from the outside throughout history. So to have this kind of a speedometer for our physiology, I think, is so important for people, and it's also manageable. I think that people seem to grasp how to control it once they have this speedometer.
I love that, because we all need this gauge. We need something telling us what's going on and having a feedback mechanism for us to know, right? It's the same idea as when we're driving in a car. If we don't have that speedometer, we don't truly know how fast we're going. We don't know if we're sticking in that 50 miles an hour or 75, 80 kilometers an hour speed limit. We don't know what speed we're truly going at. And so it's important for us to have that feedback mechanism. And this is where wearable devices can actually be very powerful, very beneficial. You broke down a few of them in your book. And I'm sure there's kind of some preference for some wearable devices versus others. Any breakdown or any thought process? Because obviously as time goes, we know we're going to have so many more new ones coming up and new options. But as of today, what are some of the better ones that you're finding help to gauge that information pretty effectively for everyone?
Yeah, I think so far the by far the best one is the Garmin watches, and I have no affiliations or with the Garmin, but I find that compared to the ECG monitor that I used, I could see that I could put Garmin's system, like 24-hour system, just on top of the ECG ones, and they were good enough.
That's amazing.
And that is because Garmin uses first beat analytics algorithms into their system. So it's really first beat that is kind of the genius here. And maybe Garmin was genius to buy first beat and put them into their watches. But the good thing about the Garmin system is that you can track it 24/7. I have a stress monitor. I can push a button any moment. I see that my stress level is now 66 on a 0 to 100. And my body battery, I have 38 left in my body battery, which is an estimate of how much fuel you have for a certain day. And I think that is the good part, that you can see in real time and throughout the day, because then you can identify that what stressed me yesterday was the lunch. It was happening from 1 o'clock until 3 o'clock, so it must have been the thing I was eating. While on many of the other ones, like Whoop or Aura or Fitbit or so on, you will get a measurement throughout the night, but you will be totally blind as to what caused this, and at which time and at which magnitude was the stress level at that moment. So, but of course, it's like for different persons, many people would not like to micromanage their stress levels in this way. They would just like to have the result in the morning and see that the result is okay, and that is good enough for them. So it all depends. It's like you have all different kind of cars. You can a beat up old Toyota would get you there, but of course it could be better to drive a Mercedes. But for most people, an old car will be a lot better than just having your feet, to move across America or something.
Absolutely.
So, from your perspective, you mentioned, that your heart rate variability changed, your autonomic nervous system shifted around lunchtime. So I always like to see, what is it you think? Was it something you ate? Was it the circumstances you were in? And do you see, for example, as we're talking about diet here in the United States, there's big discussions about sugar and artificial dyes and things like that. In your experiences, what are some of the triggers from a dietary standpoint that drive your personal and your patients where you're privy to their results? What are the big drivers? Carbohydrates?
Yeah, that would be carbohydrates, and particularly from flour-based meals, like bakery goods, bakery stuff. So my real wake-up call was when I was eating like 2 huge slices of cake. It was a colleague's probably a birthday, or maybe they were quitting their job, or I don't remember. But I was having 2 large slices of cake instead of my usual salad, and I could see my heart rate will go up from like 60 to 80. And I'm doing exactly the same job. So that was when I was seeing, okay, the food is stressful. I had never even thought of it, that food could stress your system. And I asked my nutritionist friends, they had no clue, and were not really interested either. Like, stick to your scalpel. Don't mess with the food. Let us do this. So that was the surprise, and then ultra processed food seems to trigger it. I get so many messages on Instagram from people, and I can clearly see that, eating a bag of crisps or candy or sweets or whatever can trigger people's stress systems way into the night if they sit like watching Netflix in a sofa and eating things like that. And myself, I can see that eating chili, even in small amounts that will not even feel spicy to me, will put me in a stress mode all through the night, almost like if I'm drinking 4 or 5 glasses of wine.
What's really funny, I'm very similar with the chilies, and it's red chilies in particular that drives me up. Very interesting. Not the green chilies, but the red chilies do it.
And the question is then, is it hormetic or is it just creating inflammation? So that is also an interesting thing, because it will give the same result, I think. So, and it can be hard to know if this will strengthen you in the long run, or is it just sapping you of your forces and creating a cytokine storm that I don't know. But the most important thing is I have to know that if I eat chili, then I will know that the day after I have to downregulate my system. The more important thing is to make, conscious choices, so that if I do this, then this will be the result. And of course, I've been eating chili all my life, and I had no clue that this would affect my autonomic nervous system. And I wouldn't even think that waking up in the morning at 9 o'clock, that how I feel had something to do with a meal that I had maybe 15 hours earlier. Of course, I had no even concept of this.
This is such a big deal for us that we're getting this feedback, and we're getting these pieces of very important information. But obviously we're seeing what the effect is on each individual. And this is really important because it's bio-individual. It's unique to each individual. In your book, you broke down that there are 13 factors that you've found that drive changes in HRV and heart rate variability, 4 of which are kind of genetic / spoken for. They're solid, things like age, gender, genetic specificity, that type of stuff. But the other ones are actually things that we can change. And some of them we've already brought up a little bit. We've brought up the diet piece a little bit. We've brought up stress or whatnot. I'd love for you to kind of break down what are the bigger ones that you find are the major factors that affect HRV in most individuals that they're probably not aware of or not seeing.
Yeah, the most important one is alcohol. That alcohol can have like a huge effect. And I think I've heard of no one who have started tracking their system and have not cut down on the consumption of alcohol. Maybe keeping it, for special occasions, but absolutely cutting out the like unnecessary glasses of alcohol. Another thing, of course, is food. That they have identify certain foods that they stay away from. Many people find that they have food intolerances to like gluten and milk, of course, the most common ones. But it can also be other things that they find. And then sleep, that you can understand that if you don't sleep well enough, that this will have an effect of the stress level the next day. And what more? Yeah, and certain things that just the level of that when they thought they were relaxing, they were not. It was still kind of a level below that they could reach once they start using breath work or cold plunges and cold showers and so on.
I think that goes down to this factor you've mentioned in the book called active rest, which I think is one that is completely overlooked, and people aren't fully aware that they're not in a restful, calm state when they assume that they are. And often physiologically it's not happening, even though psychologically it may be. Let's dig into that one a little bit, because I think that's one that's overlooked quite a bit. And I really loved, you mentioned a quote from a book called The Art of Finding Peace. It said the stovetop burner on one syndrome, right? Where it's just like the burner is just slightly on all the time, and it's very difficult to turn it off for a lot of people. Let's kind of get into that.
Yeah, so it's kind of that when you think you have that you're relaxing, you're still simmering. You're still not totally off, and that I think is because we are accustomed to this fast-paced society, and we think of ourselves almost like machines that we can go on and work hard and not needing any, to recharge ourselves. And of course, then once you see the results on your watch then, and you see that according to the algorithms then of Garmin or the others, they can tell you that you are speeding here. This is not compatible with a sustainable health over time, and you need to relax and kind of put the stove on zero, to turn totally off so that you can recharge. And that particularly, I've been so many people in a fatigue or burnout situation that understand that they have been pushing themselves too hard, and maybe under recovered. So maybe it's a more problem that they have under recovered than overstressed. That it's not necessarily the stress level alone, but it's that they have not been understanding the importance or necessity of recovery.
Yeah, I think that's such an important one to understand. It's not always that there's too much stress, but rather that recovery piece has not been actively provided. And the analogy that I like to use for this is this idea of a cup or a bucket that's filling up with water. And we need to utilize self-care strategies to slowly empty that bucket. The water is the stress level building up, but it's the self-care, recovery, active rest strategies that lower the amount of water that's in there. And if we don't have good, effective self-care strategies, if we don't have tools like breath work, tools like fasting, tools that help us get into a state of that active, calming, then the water level doesn't decrease. The water level remains high. And so then the next day we accumulate slightly higher levels and slightly higher levels until finally that bucket overflows. And this concept of a cumulative stressor or cumulative allostatic load is what we need to understand needs to be addressed. And that active rest piece is so important for everybody.
There's an analogy that I just yesterday had a conversation with somebody in which I was describing, my experiences with certain people and how they manage stress and how they manage the stressful things that are going on in their lives. Because we're in a modern world, we're constantly under, obligations to do things for other people and obligations for ourselves, et cetera. And I said, there's really two types of people. There are types of people who feel that if they're not constantly monitoring something that they're responsible for, it's almost like holding water in your hands. If you're holding water in your hands, you can't put it down, because if you put it down, it's going to go everywhere and there's going to be a mess. And the thing that you're trying to manage is going to just evolve into a mess if you don't focus on it. And then there's another group of people who they're holding water, but it's in a glass. And so they know that if they put it down and they walk away from it, they can come back and it's still contained. It's still, so they view their stresses and the things that are the obligations in their lives as things that aren't going to fall apart if they walk away from it. Now, there's truth on both sides of it, but having an understanding of the fact that some of the stresses in your life, you do really have to monitor all the time. So there is sort of this baseline warm pad, if you will, of stress that you have to deal with. But if you view everything in your life as you're holding water in your hands, you're going to be stressed. If you view most of the things as just glasses of water you've strategically positioned so that you're never thirsty, then it's not a bad thing. So it's a perspective on your stresses as much as the number of them.
Exactly. And also when it comes to recovery, it's important to know that you will perform better when you are better at recovery. You will be more creative. And as you wrote in your book, JP, that this salient system that will work better from your default mode network to your executive system once you are able to find calm. So it's actually better for performance. And Anders Ericsson, who had this great study of the Berlin Philharmonics, he said that the best people, they are the ones that are having more naps, are sleeping better. And that's across genres, not only the violinist, but everybody that is performing, that they should not strain themselves more in a certain day or a week than they can recover from until the next day or the next week. And that, I think, is important. And then, of course, you need to know the magnitude of your stress. You need to know how much you are pushing yourself. If you don't know that, you have no way of understanding how much you need to recover.
It's a combination of the size of the stress and the type of stress you have, as well as how you perceive it. If you perceive the stress as an opportunity, or if you perceive the stress as fun, then it's, as you said, it's hunting and fun. Is it something that's stressful, or is it something that's an opportunity and you're taking advantage of it and you're optimistic about it? So, it's interesting you mentioned the Philharmonic, because it just triggered something in my mind that I believe it was in St. Petersburg in Russia. They used to use heart rate variability and autonomic nervous system measurements to determine whether or not a student was going to be accepted into their program, their music program, because they knew that people who had high innate parasympathetic recovery mode, high levels of parasympathetic tone, were going to be more successful. And they used it as an entrance criteria.
Of course, in the ancient medicine, both the Greeks and Persians and Indians and Chinese, they all knew that the pulse and the heart rate was so central to health. And how we in the modern medicine could not understand that. That the heart rate, the pulse, has not been exploited as a tool for health, in my mind.
Yeah, it's really interesting, right?
because it's not so easily drugged. It's not so easily drugged.
There's not so much money in it. Yeah, and that is a good part, that now there's money on the front side of disease, and not just after. That people are making money to keep you healthy. And that, I think, is a huge difference, because there's too much money to be made in sick people. Yeah.
That's what's driving this movement towards longevity and health span and preventative holistic care on the front end. I think that's a really important point here to understand, is finally we have funds being allocated away from that keeping people in their sick space and managing diseases. I don't know if we've had anything cured in the last, 30, 40 years. There hasn't been a particular medication that's cured anything recently, but everything is being managed effectively. And, patient cured is a customer lost. So that's obviously, I think,
because you don't you don't cure inflammation. There's no cure for it. It's only dampening symptoms, or so it seems to me, that it's only kind of hiding symptoms and just keeping the problem still alive.
And inflammation it's a thing, but it's a thing only in the sense is it's something that cells are doing, and it's not the only thing that those cells do. In fact, that's a big part of my book, is the fact that the immune system is sort of unfortunate. It's an unfortunate artifact of history that macrophages in the immune system and the cellular basis of immunity was discovered in the context of an inflammatory state, as opposed to in the context of a neurotrophic state or in gestation, organ building and managing homeostasis. If it had been, I think we would have a very different perspective on the immune system. We wouldn't view it as just this system that protects us and then sits idly waiting like a sniper in the hills, waiting for something bad to come along. That's not what it does. It's the farmer. It's the farmer who is working every day in the fields to make certain that the community can eat and is doing well. And it's only, when there's an invasion that farmer picks up a weapon and goes off to defend. And frankly, that's the worst time. That's the time you don't want to. It's the thing you don't want your immune system doing. So inflammation is a very important measure of whether or not the system is able to maintain itself and able to exist in a homeostatic or a harmonious state.
Yeah. And also, you asked me the major things that people didn't know about when it comes to stress. And one of the things is a too low fitness level. So if you have a really poor VO2 max, it may be even down to like 26, 28, below 30, then anything you do will tax your system too much. It's like having a really, really small engine on a truck. It's you really have to have a good VO2 max. And when you have a good VO2 max, I can see that you can tolerate so much more stress of all causes. They can tolerate food, or they can tolerate alcohol better. It's kind of like their mitochondria all over their body is working better, so that they have a larger capacity for anything that life throws at them. That is important to say, I think.
I think VO2 max is probably the best marker of efficiency of function within the body. And as we become less efficient, it becomes far more taxing for the body to do little things. And so your fitness markers are so important to understand, and something that a lot of people don't put a lot of effort or focus on. That said, have you seen any correlation to types of exercise that might be more beneficial? Is it more of a cardiovascular fitness is a little bit better towards increasing HRV levels, or more weight training, or is it a combination? What are some of the factors that you've found to be involved in increasing the HRV from a fitness perspective?
It seems to me that endurance training, cardio seems to be better, but I've also read accounts that strength training is also equally good. But my impression from seeing people and reading their results on their watches, is that endurance, people running, jogging, some kind of endurance training, they seem to have better systems.
Interesting. I was just reading about this last night. In fact, on the flight back, there's the third bucket, which I don't think that we oftentimes give its due. There's the endurance sports, there's the resistance training, but there's also balance and reaction type sports. I'm blanking on the term that they used, but I know it's something that Peter Attia talks about a lot also, is the ability to balance yourself, the ability to sort of hold something from shifting around. He likes moving weights that are unbalanced. And what I read last night was that racket sports, so tennis, racquetball, badminton, things like that, are the number one sport in terms of people participating in them living longest, and it, sort of adding years to your life on average if you participate in them. And I think that's the same kind of function. It's not only endurance, there's strength involved, so it's a little bit of resistance, but not really. But there's that ability to move into position and to coordinate your body in a way that's different from just running or cycling or rowing or something like that. So I thought that's really interesting, and it's a sort of a nuance to the exercise.
Yeah, there's a really interesting. I read a very similar study. I think it was one that was posted by Peter Attia, and he mentioned that tennis and racquetball increase life expectancy anywhere between 6 and 9 years, based on the effect that it has on VO2 max. Things like cycling, running are closer to 2 or 3 years increased, and then the weight training things don't make a huge difference in terms of longevity. But I think there's balance and space for both to take hold. But if you don't have good vascular and cardiovascular and respiratory fitness, then you're not going to be able to breathe through a lot of the stressors that life is throwing at you. And so as your efficiency of your breathing decreases, it's going to be a sign that we're having these challenges. And not breathing efficiently, as we know, is the main driver of HRV, right? Where we have this respiratory sinus arrhythmia driving HRV either up or down, depending on how well we are breathing, what our breathing mechanisms are, what our breath efficiency is. So that plays a major role there.
I think it's a function of the fact that you want to be able. I oftentimes talk about my dog, and the fact that my dog, most of the day she's lying on the ground, tongue hanging out. I mean, just trying to get cold on the tiles of the floor. But anytime somebody comes to the door, she gets up. Her breathing is very fast. She's barking. She's being aggressive. But 30 seconds later, she can be back in the same position on the floor. And that ability to have a high heart rate variability, but immediately drive yourself into that sympathetic aggressive state and then back up. It's almost like the Maasai warriors who could be sound asleep and battle ready in 5 seconds. That ability to be resilient is a function of your ability to move between those two states efficiently. And I think that racket sports are much like race car driving. They've done HRV testing on race car drivers and Formula One drivers, and they can see that when they're on the straightaway, their heart rate variability is very high. When they're going in through a series of turns, their heart rate variability is extremely low, and they can bring it back up and down very rapidly. And I think that that's why those racket sports are different, because you're constantly going back and forth between a resting state, waiting to see what happens, and then an attack mode where you're racing the ball to or the wicket or whatever in order to to make your move. And I think that's something really important, because they're also talking now about endurance sports, that just going out and running 10 miles once a day isn't anywhere near as valuable as doing half a mile, or even just doing 5 minutes of walking once per hour. That is so much more valuable because you're doing it more frequently. You're putting yourself into that stress state and then resilient, back and forth. So I think there's something to that. And in your experiences, do you see that also with heart rate variability? It's a resilience thing as opposed to a absolute magnitude?
Yeah, I think it's a lot to do that you are able to control your stress level. That when you want to be stressed and use your forces, you can do that, and that you can easily downregulate and recover when you want to do that. That you have to control yourself. It's not only dependent on outside circumstances that you are stressed if it's a lot of stress around you, and that you are calm if it's calm around you, but you can manage and control this, regardless of circumstances. And that is probably what you would need as an athlete, to be able to control it. And I know that you're talking about racket sports, and I remember the Jim Lure, I think, did an survey on tennis player, and the best tennis players were the ones who could get their heart rate down between the game itself. So just in between when they had the ball and probably breathing, getting their heart rate down, they were the one winning after like 2 hours.
That makes a lot of sense. I think it drives this concept of interval training as being how we can turn on the sympathetic system when necessary and actively train to become active recovery specialists when we're not in that training mode. And so interval training helps to create this active efficiency when we're on in the sympathetic state, and then turn to parasympathetic and teach us how to bounce back and forth between those two states really effectively, really efficiently. So I think that is probably this concept in action, and why interval type sports or racket sports, which are interval based sports, have this same or similar effect.
Absolutely. Be interesting to see if there's a way to do some sort of biofeedback to train people how to do this, so that even in the doing some form of wearing an Aura ring and monitoring it while running.
So I don't know if you guys know much. I'm holding up, for those who are listening, I'm holding up a box for HeartMath, which I don't know if you've had any experience utilizing, Dr. Færø, at all. No? You should absolutely look into this. I'm very intrigued. This is by far, in what I've found, the best biofeedback tool, teaching you how to go into a state of what they call coherence, where your heart rate variability, and breath rate are all synced up into a state where coherence is optimal. And so training yourself to be able to pull yourself into that state, really, really powerful tool. Any biofeedback tool that provides you a sense of where your HRV is at, and teaching you how to utilize your breath with certain guided tools that you can then utilize later on, I think is one of the best. But I've found HeartMath to be really powerful for people that are willing to invest that time.
Yeah, I've used quite a lot of Muse too. The headband that measures the EEG to calm yourself down. So that is a neurofeedback system.
Yeah, those are great tools. I think biofeedback is something that hasn't been. Luckily, we're getting into the state where it's being utilized far more, but it is one of those ways that you can actively train yourself to move between sympathetic, parasympathetic effectively, and teaching you how to utilize your breath, teaching you how to utilize the calming of your mind, the thoughts, changing your perception, and be able to get a little bit more objective rather than being the subject of stress. That's really what I find biofeedback is in a very practical sense. I'd love to get your sense. One of the things that you brought up in the book was about digestion, and I'd love to get into, we mentioned diet, we mentioned certain foods, alcohol being major drivers of stress, but I want to talk a little bit about fasting, because I want to know what your take is on the use of fasting as a tool to help provide that time for recovery, for the digestive system to work a little bit better. You mentioned the 5-2 strategy. But I'd love to kind of get your sense on how we can utilize fasting as a great tool to help improve HRV.
I came across fasting rather accidentally. I was working at a place in Norway where I got the food from the kitchen of the sick people's place. And it was so good that I used to gain like 4 pounds every week I worked there. So I thought, I cannot do this. I need to find some solution to this. And then my solution was to skip breakfast. And then I had never done that, of course, in 50 years, before I did that. Always eating breakfast was kind of what we did. And I was expecting to see a lot of stress because it felt so, painful, to be hungry. But when I saw the results on the monitor, I saw that, okay, I was so calm that I almost in any other time that I'm not. So I could see that the fasting state is a very calm state. And that is probably why it's been a part of all religions as a way to sharpen your minds. And maybe it's also a trigger for kind of anorexia on those kind of diseases that will give you calm, when you're not eating. Well, of course, we would think that it's stressful not to eat. When you see that it's a sense of calm on your system, maybe that's one of the triggers behind anorexia. Anyway, I can see that so many people get better heart rate variability when they are fasting or when they're on a fasting mimicking diet. That is kind of eating 700 to 1,000 calories, that they get better results on their heart rate variability. And of course, it's probably also coupled to autophagy and mitophagy, that the cells your body starts eating the worst senescent cells instead of the food that you're providing. And that is kind of a cleanup of your system, kind of a recycling of a material that is healthy. And that you can see it on your monitor is also motivating. That the hard things that you need to do to cut alcohol, to cut down on nicotine for the ones who use that, and to do fasting, to do cold plunges, that you can see the effect in real time is so much more motivating than the more abstract idea that you'll benefit from this in the future. You can see it in real time. And fasting is one of those things that when I see the results, it's easier to not eat or eat less for a day.
Yeah, it's pretty motivating just to recognize that the most effective longevity enhancing practice that we have as a species, and frankly, it works across all species, is caloric restriction. The easiest way to survive in a caloric restricted state is simply just to intermittent fast. Just only eat for during an 8-hour window. It's actually remarkably easy to adopt. Yeah. And you get it out of your head that somehow, breakfast is the, most important meal of the day. That was a branding or advertising slogan. Wasn't a scientific fact. So, yep,
Amazing.
exactly.
Are there particular fasting strategies that you utilize or that you recommend to your patients if they're looking into starting it?
Yeah, I think the most important is a restricted feeding window of maybe 8 hours. Okay. 8 to 10, I think between 8 and 10 hours of eating seems to be perfect for most people. Some people, it seems, particularly women, needs a little bit more time, but at least have 12 hours, I think. If you're eating for more than 12 hours, it seems to be connected to disease. And you will feel tired. You need that. Your intestines is a very vulnerable system. It's only one cell from the content of your intestines until the bloodstream. So it's like kind of an open wound. And so many people have inflammation in the system and leaky gut. And to have enough downtime so that your intestines can recover, that I think is so important.
Yeah, no question about it. I think that downtime piece is really important to implement. And JP and I are both pretty adamant about this concept of that restricted feeding window and depending on each individual, right? Like find kind of what works best for you type of concept here.
And it seems to be enough for most people. So I myself, I'm not so much into more fasting. It seems that I can keep my stable weight, at that with that activity, and I don't feel that I need more fasting. And to improve your autophagy, you can also exercise while you're fasting. So you can get the effect of a 3-day fast just by doing time restricted eating and go for a run or do exercise. So
yeah, I actually believe that that's the best way for weight loss also. And, my weight loss trick, and I've, I've lost about 50 pounds since my most decadent state. Um, and it was really very simple. And for people out there who are interested in losing weight, it's exactly what you just said. Do your intermittent fasting, but do your aerobic workout in the morning, and you will have effectively extended the period of time from your body standpoint for autophagy and for weight loss. Because the first thing that happens is during the first 7 hours after you've stopped eating, you're going to use up all your glucose. And then you're going to use up the glycogen that you have when you work out within a very short period of time also. So if you're doing, running some measure of a distance, at 5, 6, 7 kilometers or more, what you're going to do is you're going to have burned through all of the various different fuel sources other than your ketone bodies and fatty acids. And you're going to mobilize those out of your blood, out of the fat cells, because your insulin levels will be so low. You want to get your insulin levels really low so that your fat cells will actually release the fat. And once you get to that point, we talked about mitochondrial health. Once you get to the point where your mitochondria are flexible and they're able to utilize all sorts of different fuel sources, and you're mobilizing those fatty acids out of the fat cells, the weight will literally just fall off you. It may take 2 or 3 or 4 weeks before you get to that point where your body is in shape enough to do it. But once you get there, once you get through that first month where you might not see the kind of benefits you were hoping for, then all of a sudden it will accelerate and it will just melt off you. And you'll feel so much better and you won't get injured. And all the wonderful things that you just mentioned about getting rid of senescent cells and feeling sharper, getting rid of brain fog, all of those things, your mood will improve. It's a wonderful state to get yourself into.
I agree, and I used to do all these things wrong. That, as I write in the book, I used to do everything wrong. Every advice that I give in the book, I did wrong, and I used to weigh 40 pounds overweight myself, more than I do today, and I did everything wrong. Drinking more or less every day, using different modes of nicotine. I did not care what I was eating, working as a doctor in the ER at nighttime and shifting the circadian rhythm constantly. And we didn't, as doctors, we didn't know that it mattered so much. We thought that, okay, if you did everything right, maybe you'll live 2 or 3 years longer, but it would take you 2 or 3 years to do that, sleep longer and exercise and make food from the bottom, and why bother? But now we know, of course, that you're talking maybe 2 decades of life, extra life, if you do the right things. So it's a whole different story now.
Yeah, I've been looking into this, and the number of different chronic illnesses and the percentage of people who have them related to BMI and percentage body fat. I mean, the correlations are crazy. But then when you layer on top of it, when people die of these things and what age they die of it, that's where it really drives home for me. For example, yes, we all know that if you're overweight, you have a higher risk of deaths from cardiovascular disease. However, what you don't know is that when you're a normal BMI, if you die of cardiovascular disease, you're dying at age 75 or 80. If you're significantly overweight and you die of cardiovascular disease, you're dying in your 60s. I mean, it's 12-year difference. So to me, that was what drove it home for me. It's not just, yes, more people are dying of heart disease if they're overweight, but they're also dying much younger. So you're not only just dying of it, but you're losing decades
Being
of
in
life.
the ER, is this something that you started to see quite a bit in practice that drove you to kind of look into this more?
Yeah, I saw more and more that it was because in medical school we learned that getting a disease or dying was a matter of luck or genetics, and except for quitting smoking, it was not so much that you could do. But after working for so many years now, I could clearly see that there's a kind of a type that comes in, kind of people who comes in with these diseases, and then maybe 10 years ago, before I changed my life, I could see that I was starting to look like them, overweight, sloppy, and not exercising, and you could see their energy level just by watching them, that they have a poor fitness level, poor energy level. And I could see that the ones who were exercising, the ones who had a normal weight or slim, I would see them far less often. So that was motivating to start to read up on what we could do to keep healthy instead of just treating disease. Because as doctors, we just learned how to manage disease and diagnose and find the right treatments. We didn't learn how to create health, which is a totally different way of doing it. And of course, learning how to create health does not take a long time. You can do it in a weekend. You will know the basics of how to stay healthy for the rest of your life. And it's even free. Almost all of the things that can keep you healthy does not cost any money. It's once you get sick, it starts getting expensive. But that I had to learn on my spare time. These subjects, and I understand that most doctors will not do that. I see that most of my colleagues, and particularly at my age, I'm 55, they have no clue about preventative healthcare. This is I did not have, 10 years ago.
Well, I'm glad that you were able to find some of those strategies and make those changes. I'd love to ask, what are your top 3 practices that you engage in every day, or things that you swear by that, are making really positive changes to your health and keeping you in the state that you're in?
Yeah, that would be sleep, to have a sleep consistency, go to sleep and wake up more or less the same time every day. The intermittent fasting or restricted feeding window I do every day. I make sure to exercise a little bit every day. I do push-ups and squats every day, 50 of each, so that you every day do something to build strength. And then I go for a run, not much, maybe half an hour, 2 times a week or so. So I try to because I don't have so much time, writing a bestseller and all. So I try to train as little as I can. That is enough. And then, of course, I make sure to not eat so much ultra-processed food. I'm not drinking alcohol, maybe 3 times a year. So I think that's the most important thing that I do. And that's enough, I think, because so many people are talking about health optimization, but I'm talking more about health normalization, what is good enough, because so far I'm not impressed by the ones who are health optimizers. They don't seem to do better than the patients that I'm meeting that are 90 or 95 years old and still functioning. And they have done nothing particular. They have been just living life and being active, being out in the sun. I make sure to get sunshine. That I do, because that's the one thing that I've learned recently, that sunshine is so important for us, and probably for the vagus nerve as well. I'm sure for improving mitochondria, for nitric oxide, for melatonin in the cells, and so many functions that we get from cooperating with the energy from the sun that we have overlooked as doctors. And that I think and vitamin D. But the problem is that as doctors, we thought that, okay, we get vitamin D from sunshine. Okay, so let's stay in the shade or stay inside and take supplements. And that, of course, is not enough. So vitamin D is a marker that you have gotten enough sunshine. But we have collectively, as doctors, been warning people to stay in the sun. Using sunscreen, staying inside, and not thinking about what are we losing, what will happen to a species that comes from Africa when you take them out of the sun. And what we can see now from the UK Biobank study is that if you get enough sunshine, you can reduce the risk of heart disease by 25%.
Wow.
and the risk of cancers by 15%. And it's not even increasing the risk of melanoma that we have been so scared of. So I think there will be a huge shift now in the future of getting more sunshine and making sure that you get more sunshine. Of course, it's also free.
That's the reason why they put sunscreen on you, so that you'll buy the vitamin D, fortified.
By the way, isn't even the active form of vitamin D, right? It's just 25 hydroxy, which needs the sunlight to put on the 1 hydroxy as well.
And this logic that you would think that if the body has come up with a system to make vitamin D, that this would be the only system that the body have been coming up with throughout evolution. This short circuit in our medical brains, I don't know where it came from. Of course, now we see that there will be hundreds, if not thousands, of biological processes that are using light or in different ways to modulate or improve physiological processes.
I think it's particularly important in northern climates. You're in Norway, I'm in Canada, like we need it more. And so I'm starting to see it. I'm sure you are as well. You've got the sun setting close to you where you are, I imagine, pretty soon. Right? We don't get that much sun, particularly in the winter. So we're looking at 6 months a year. I know, JP, you're in Florida. You get your
I'm to Florida.
It's definitely a draw for me to say, like, I'll get sunlight more often and be outdoors. But even in northern climates, in the wintertime, we go outside and we're covered up in like full winter gear, right? So we're not getting that sunlight exposure. So when we can, I think it's important for us to engage in allowing that sunlight to enter our bodies, and maybe don't need all the sunscreen, and maybe we don't need all the coverage and layering up our kids with like tons and tons of different clothes and whatnot, right? Allow the sunlight to actually hit their skin, allow them to engage in outdoor activities, go outdoors and throw the ball around with your kid whenever you can, or do something along those lines. I think those practices allow for this to occur a little bit more readily. And I love this concept of health normalization, because yes, we want to optimize at some point, but it's not entirely realistic for everybody to go from where they're currently stationed or where they currently are sitting to a complete optimization area. We want to create normal habits that each of us can follow that are utilizable by people that are living in what we call the real world. And I think that's really powerful here, Dr. Færø, that you mentioned earlier. We want to create this idea of normalizing what it means to be healthy and to live life as best we can within the world that we live in.
That's right. And I think that should not take too much effort. I'm thinking often that, okay, if you pay attention for 1 hour every day to your health, make sure that you get enough rest, that you exercise a little bit, that you make sure that you eat some salads, that you maybe just 1 hour every day, you will get years back, for that. That's a huge investment, I think.
I love that. JP.
Wonderful message for people is that they've got the time to do it. And if they take the time, they're going to get more time.
And I know from working as a doctor in the ER that to do the opposite, to not care at all and just hope for the best, that will give you 20 years of suffering, of managing 2 or 3, 4, inflammation-based diseases like heart disease, high blood pressure, diabetes, depression, all of these things that we medicate, very regularly. And if they don't take that hour a day to prevent getting that, they will have 20 years and visiting specialists, changing medications. It's kind of almost at least a half-time job, to do that. And it's
and the thing that's so frustrating is the for me is the perspective that's been given by the medical community to patients, which is that you have a chronic disease, which means it's never going to get better. I mean, the idea that somehow diabetes is not something that you can recover from, or that hypertension is something you can't recover from, or, depression is something that you're going to live with for your entire life. These are not chronic conditions if you change the conditions in which they arose to begin with. If you keep the conditions the same, then yes, you're going to need to be medicated to mask the symptoms or to try to counteract them forever. But just change the underlying conditions and it'll go away. It's a dynamic system. I think Casey Means talked about this when she was on a podcast with Huberman. She talked about the fact that we think of ourselves as sort of static and the world around us is changing. But we change. Every cell in your body is going to turn over within, a matter of, it could be a couple of months, could be days in your digestive tract, it could be years if it's, fat cells or muscle cells, etc. But everything's turning over and everything's constantly changing. We are not static entities. We are a process. We're processes. Change the process, you change yourself. Change what the circumstances, you're going to change who you are. And you'll change the conditions that you're experiencing.
Exactly, and Casey Means, she works at Levels, the blood sugar monitor, continuous blood sugar monitoring, and I've tried that myself. And then also, when you can see the effect on your blood sugar, what you're eating, and you manage that, because I was pre-diabetic when I first tried that. And then I became so much more aware of what kind of food can I eat and what will be the effect on my system. That after that, I have now perfect blood sugar levels. So I probably would have ended up getting diabetes if I did not make that change. So I would also advise people to use a continuous glucose monitor for 2 weeks and not change anything, and then try to eat as well as you can for 2 weeks and see the difference and then feel the difference too. So you'll feel the stress of these blood sugar spikes throughout the day. So
yeah, you need to understand that baseline first before you go and you make the changes. Understand what are the specific triggers for you as an individual, right? Like I've heard people talk about certain types of foods. We earlier mentioned like peppers are going to drive things up. Well, maybe not blood sugar, but on the HRV side, but maybe there's a certain food, or maybe you do well with like cooled rice and something that's a little bit more fibrous than you do with warm rice, right? And having making those little changes later on, but you need to know where you start first. So those 2 weeks without change and then follow 2 weeks with change, I think is a really powerful way to do it.
This is what I would recommend people also with wearables for their heart rate variability, that they maybe for a month don't change anything, just pay attention and see what's happening and don't change your lifestyle, so that you have this baseline that you can start from. And it's also then kind of a gamification of your life that you can. It's a lot of people ask me, will it not just be stressful? But that is not what I find. I find much more that people think it's actually fun to have this window into their autonomic nervous system, and they will treat it like a game where it's their own life and health that is at stake, and not just an avatar in a game.
Absolutely.
Yeah, I was just going to say that Dr. Habib and I met as a result of a mutual friend who he himself was significantly overweight, dropped some of the weight, had family members who had died of the consequences of diabetes, was diabetic himself, had HbA1c numbers that were, scary. I would say they were like around 14. And he, was on massive amounts of metformin, brought his HbA1cs down to, 8.5 or 9. No matter what he did, he couldn't get himself down to the point where he could really drop off the metformin. And I'm putting a plug in now for vagus nerve stimulation as a benefit, because what he did was he started using a vagus nerve stimulator. He was still doing all the exercise and, eating salads and things like that he was supposed to be doing. And he began using a vagus nerve stimulator, and he went back to his, it's a great story. He went to his doctor, and his doctor did every 3 months does a quarterly blood test, came back in the room and said, I'm sorry, I don't know what happened at the lab. We got to do it again because something was wrong with it. And he, sort of knew what was going to happen. He said, sure, go ahead, take another vial. Took another vial, he came back and said, I don't understand. It's your blood sugar is a 5.1. Your HbA1c is a 5.1. And, what did you do? he said, well, I can tell you one thing. I stopped taking the metformin. He went off the medications, used vagus nerve stimulation, and by regulating his autonomic nervous system, still while doing all the right things, but just doing the right things while having a dysregulated autonomic nervous system, you're not going to get all the way there. By regulating the autonomic nervous system, he was able to get all the way there, and now, he's regularly in the fives. Still a little overweight, no question, but he's regulated it because he's got the root cause of the problem, which nobody recognized. That the root cause of the problem is.
I think the key is progress over perfection, right? Like, take steps to make the positive changes, start working and progressing in a positive way, and things will fit into a space where they'll get you going in the right way. And you'll start to notice positive changes occurring that you didn't realize you were experiencing. I think all of us at some point have lost a significant amount of weight. And in doing so, along that way, and I'm sure you'll both agree with me, that we saw weird, fun changes occur along the way that we didn't realize were happening along that route. And such an important thing to understand is you don't even realize what your body is experiencing until you no longer experience that, or you experience something different and you become aware of it. And awareness is the key to creating that change. You can't change it if you can't truly measure it or monitor it or keep an eye on it. And that's where wearable technology and the use of tools like heart rate variability can be so empowering for us and should be empowering. There shouldn't be stressors. If your HRV is low, don't stress out about it. Do something about it. Create an active plan to improve it. And I think one of the best ways to do that is to pick up The Pulse Cure. Wonderful, wonderful book, Dr. Færø. Where can people learn more about you and the book, and where can they find you?
Yeah, the book is available everywhere, Barnes & Noble. It's a standard published book, and it's also an audiobook, so maybe podcast listeners would like to hear the audio version. So they can get it, anywhere. And I also have a website called thepulsecure.com where they can see a video lecture where I'm telling and showing how to use the Garmin watches and what they will find when they eat and when they drink alcohol. They can see it. And I'm on Instagram. I'm Dr. Torkil, dr.torkil on Instagram. So they can see more there. And I'm on loads. I'm probably on 60, 70 American or UK, Australian podcasts also talking about these things. So they can learn more. I would love to learn more about the device, though. So
we will talk a lot about that. I'll connect you guys, and you can definitely chat it out. And we're talking a little bit about the Truvaga here, I think, being a great tool for adjunct support and pushing us into that parasympathetic state and creating that efficiency by which we go sympathetic, parasympathetic. Wonderful tool. And our listeners know all about it. But I'll let you guys talk about that offline. JP, any last thoughts there?
No, just fantastic conversation. So happy to have met you and appreciate your work, and glad to be part of a team that's educating the world on things that unfortunately the medical schools aren't teaching, but it's knowledge that we need to get out there for everybody.
Well, thank you so much for joining us, Dr. Færø, and for everybody who's listening to this point, thank you so much for getting here. And I recommend just sharing this with one person who you think could utilize this information to upgrade their health. And we'll catch you on the next one. Have a great day, guys.